Hey, in today's session, we will be discussing how to manage PHI and the best practices for handling and sharing PHI securely. So, one of the first steps in protecting PHI is determining uh, how, who, what, when, where, this kind of questions. So normally what types you have in your PHI records, where it can be found in your organizations, what systems handle it, and how it transmitted, and whom you disclose all this data. So you should take time. So if you are a security implementer like HIPAA implementer, assessor, or the auditor, you should interview personnel to document those systems, processes, and who has access to them. So you are probably not aware of every task and situations that your workforce members encounter daily, but interviewing personnel is one of the best way to get like kind of insight on how you interacting with who's using the PHI, how they are managing the PHI on a regular basis. So it basically will help you to discover uses access to the systems or certain disclosure of which you are not aware about it or which you are not aware about it. So that will help you to understand. So I mean, I'll give you an example. Probably you have seen this kind of situations, like if you go in hospital and if you ask them to print something, they might be not aware if they have taken the additional copy of it. Suppose if you forget it, or if you needed just two copy, they have printed this three copy or four copy. What will happen for those additional copies if they are not properly trained? Or even one of the scenario, if they have saved your data electronically in somewhere like an email or any part, which we'll discuss where to save in this later section of the video. But if they are not aware how to manage the EPHI, what will happen? It will lead to the bigger breach and and whatnot. So reputation damage, money, ransom, and everything comes to your way. So this is why you need it. And now to assess the current posture of your PHI, what you need is first find your PHI. So detailed PHI flow diagram is actually essential for your risk analysis because that shows how people, technology, or process interact to create, receive, transmit, and maintain the PHI. So basically, it shows the collaboration. The PPT's collaboration with the PHI management. And data flow diagram reveal where you need to focus on your security efforts and your training. So these two are also one of the security and the trainings are also the essential part of it. So it will show the entire collaboration between the PPT, the people process technology, and the management of the PHI and the security requirement and the security implementation part of it. So in the next slide, I have created a simple flow of a hospital or a lab where a patient had requested the some test, let's say any test, blood test, let's say a diabetes test, and this is how the flow will take place. So in the first flow diagram, the lab has updated the result, and he has pushed the result to the system. So you can see, and the lab has pushed the result to the systems. So the firewall is connected here, and here it is a patient record management systems in the web applications. It is separated in is in a separate VLAN. Here we do have the database clusters, which is a separate VLAN, and the third is the mail servers clusters, where it is a separate VLAN, where is a VLAN A, B, and C. So all these three systems are secure, like segregated in a different VLAN, and from here he has pushed the result from one. The process goes to here, and this crosses the firewall root are checked. Then comes to the here patient management record systems. It's been done, and then it has been pushed to the clusters database, and then it comes to the point 3 where it will send in notifications to the patient. Hey, your result are ready to review, ready to view, whatever you would like to do. So that notification could go like by text, by email, or WhatsApp or anything else. In the next diagram, if you see here, patient receives the notification via email, or let's say they have a lab result to view, and then the patient logs into the web application here and two, and then the portal pulls the lab result from the database, and then portal displays the lab result. So in a flow, it shows every entry points, what is basically the logic, what is happening in the applications. That will give you a brief idea to find the PHI entries. So for the PHI entries, think of both new and the existing patient record. PHI can begin kind of from patient if filling an application form and giving their informations to the receptionist on the reception, or the people who's asking the data, what kind of disease they have, what they're experiencing, what's their date of birth, what's their email ID, what's their phone number, what's their age, blah blah. And then they are kind of the backend office interacting with the physicians and their consultant and the business associated, they're faxing about any other informations, if they have any past record, or like any patient ID, or there any unique IDs already present in the systems. So specifically when you looking for the PHI entry of the data, you need to particularly focus on these area. So this is the PHI entry points where you can find. So email, how many computers do you have, and who can log into each computer. Then the printer, you ever print the patient data. So this is, the printer is really a crucial part of it. People normally ignore it, but it shouldn't be. Text messages, who owns them, who has the mobile devices, and EHR entries. So EHR is nothing, is simple employee health report. So how many staff member do you have entering the data? Like what's at particular time, like 4 p.m., what was his vitals, what was his oxygen report, oxygen levels, what was his heart rate, and everything else. Faxes, how many faxes machines do you have? Do they accept the PHI? The mail, whose incoming mail handles, what does it contain any PHI? New patients papers, how many papers are patients required to fill out, and where? Front desk, in the examination room, in the operation theater, or where? Business associate communications, how do business associate communicate with you? Do they interact with PHI? So business associate, you probably have find people like who's helping with your insurance, people who's helping you to or explaining you to which bag to take, where to move, which floor you should go. I mean, those kind of people will help you. Databases, so do you receive marketing database of potential patient to reach out to? What record and data do you enter into the database? So nowadays it has kind of grown a large. Websites, do you accept an PHI online? You need to document. Like if you accepting when someone want a appointment with the particular doctor, so what kind of data you are accepting on your website? Few people accept simple, you enter the username, password, and you select your doctor. Few even ask the any old prescriptions, any old health reports, maybe your SSN number, maybe your Aadhaar number if you're in India, or your PAN number, or your driving license number, or anything they may ask. So then now comes to when you have all the entry point, where it will go. So this is the exact locations you need to look for it. So this is the most common places where PHI is stored. So EHR and EMR systems. And so EHR is electronic health record, and EMR is electronic medical record. So mobile devices, workstations, email servers, laptops, computers, applications, calendar software, operating systems, encryption software, shared bin containers, non-approved storage locations. So this is one of the also a crucial non-approved storage locations. So everyone is just nowadays, normally when you have the shared something, or maybe you're just copying some data in some random places and no one is aware about it. Where like one executive, he found some of the information, or he needed some information from the patient, let's say your X-ray report, and he stored in somewhere in a system, or maybe he's not aware, which was not supposed to be there. So this kind of data you need to look for it. Wireless network, medical devices, physical location, and any storage, filing cabinets, and etc. So now, when you are done with the stories, the most crucial part is PHI transmission. So when PHI leaves your organizations, it is your job to ensure PHI is transmitted or destroyed in your most secure way possible. You and your business associate are basically responsible for how the business associate handle your PHI. If anything goes wrong, it's solely your responsibility. Is hospital's responsibility to secure, or is the one who's following the HIPAA compliances or the PHI enabled compliances? It's their responsibility to make sure that when it leaves organizations, it goes in a secure way. So some point or something to consider when it leaves the organizations, the business associated. So are you sending data through encrypted transmissions? Is the data sent to them kept at a minimum? Like what's suppose they are having a mobile devices where they are holding the data and they just holding the data for 40 days, 3 months, 4 months. Whenever they want the data, they have the record. Even they never wanted to have this record for the particular patient, but still they have the record. So what will happen if something goes wrong? Like in one of the most occurring incident is mobile theft, kind of like losing the device. It is one of the most sensitive area. Email. What procedures are in place for how patients receive the data? Flash drives. What policies are in place? Do they include the encryptions and the website? So are patients able to access PHI online? How are those pages are protected? Have they undergone vulnerability scans and pen testings? So like it covers your abstract part of it. So when you are done with the PHI transmissions, so now let's move to the PHI restrictions. So as you work on your risk management plan, you are prioritizing removing unnecessary patient data. Before destroying old data, you will need to know how long you are required to keep the data. Like in US, many states, they have required the specified the amount of time you must keep the patient data. For like commonly, I guess for organizations, data compliance to maintain is for 10 years. But if patient has died or he has passed away for some reason, there will be some additional requirement for the data retentions. Maybe he died, so the patient's family has requested some further probe what went wrong. They'll do the postmortem, all those, everything else they'll do for. So in that case, the judicial authorities may require all those evidences. So when the time get extended, right? So if you delete sensitive informations like patient record, social security number, Aadhaar number, PAN number, driving license, it will still be in your computer and accessible to attackers if it isn't securely wiped. So normally what happens when you wipe out and or when you delete and file from your hard drive, as a normal user, for you, what happened you see is being deleted, but what's happening in the backend is just letting know the drive that this space is uh, available to use. This is what happening. But as a normal user, you will see it has been cleaned, your data has been deleted. But as a advanced user, or let's say someone is attacker or has the advanced capabilities, he may use some of the data recovery software or any mechanism to recover that particular portion of it, and he'll be able to access that data. So this is really important for you to understand. So as per HHS regulations, such as 45 CFR 164.310 D2 1 and 2, what it says that the HIPAA security rules require that covered entities implement policies and procedure to address the final disposition of electronic PHI and or the hardware of electronic media on which it is stored. So basically, HHS here is determined that for electronic PHI overwriting using software or hardware product that overwrite media with non-sensitive data is the best way to securely delete sensitive patient data on a system is still in use. So what is saying? They're saying if you have some of the sensitive data, you just override with the non-sensitive data or some of the garbage data over and over and over and over again. So what will happen if someone has the access of it? He'll not be able to find the sensitive information because this has already been rewritten for several times with the garbage data. So when thinking about how to permanently delete files of your network and your storage, don't forget about kind of archive data such as local backups, cloud backups, external hard drive backups, CD or DVD backups, email, FTP, server backups, mirror backups, and offsite backups. So now the PHI encryptions. So as per the HIPAA requirement 164.312A, 2, 4, and 12. So if you need to store PHI for any period of time, encrypt it. It doesn't matter you're storing it for 1 day, for 1 year, for 1 decade, you must encrypt it. When implementing properly, encryption renders file useless to attackers because the information can't be read without a decryption key. So what will happen if your data is already encrypted, even though if you're part of some of the ransomware attack, most of time the hospitals are facing the ransomware attack where what they'll do, they'll encrypt the files with their encryption keys, and they are forcing the organizations, the hospitals to give the the X amount of the ransom, and then they'll release you the decryption key. So that is not a guarantee at all that they'll give you the decode keys. So what you have to do is just encrypt it, even though you are storing data for 1 day. So what will happen in that case? Even though if the attackers, if they get the access of your data, for them is useless. They can't compromise you or they can't kind of force you to give the X number of ransom, and the most importantly, they'll not have the access of the sensitive data. So HIPAA requires healthcare entities to implement a method to encrypt and decrypt electronic protected health informations in requirement this. And PHI that is created, received, transmitted, and maintained in systems and on work devices, like it also include the mobile phones, desktop, flash drives, hard drives, and everything should be encrypted. I mean, simply they are saying wherever you are storing your PHI data, and if it is part of the organization, it must be secured, it must be encrypted. So if your organization determine that encryption is not reasonable in your environment, you must document that decision and put other protection in place to protect PHI to same degree as encryption would. So like suppose you have a requirement that you can't encrypt the data, then you should have some same compensating control in place to protect that data. So maybe your authentication and authorization should be more strong. Your application must be accessible through the HTTP only, kind of controls or measures you can take. As a security organizations, like view encryption as a critical to all the PHI stored and transmitted by your organizations. So as I previously mentioned, you need to make sure that you map out where PHI is created, when, where it is enter your environment, how, where it is stored, and what happens to it after it exits your environment on organizations. So normally, although kind of HIPAA regulation doesn't specify the necessary encryption industry best practices to use these encryptions types, normally it's like kind of ES128 or ES256 or better. So due to the complexity of the encryption rules, healthy organizations often use third parties to ensure PHI encryptions. So this is partially because organizations should keep decryption tools on another device or in separate locations. So because of lots of life-threatening kind of or life-supporting systems is available, so you should not have your decryption key stored on the same systems. And also the actually the limitation for the health industries here, they are using lots of IoT-based devices like glucometer and health monitors and heart monitors, and they may not support their chances because of the limitations, the higher end of the encryptions. So you need to align, you need to understand what's your business criticality, the business requirement, the applications requirement. You need to align, you need to bridge the gap between all those with your people, process, technology, and the your environment. So your data must be protected at each time whenever is departing your organizations or when it's coming to or entering into organizations. So there's one more is full-time encryptions. So one of the largest reported threats to electronic, as I mentioned earlier, PHI has been the loss or theft of a physical device. So while employing adequate physical security and media movement procedure in a first line of defense to prevent these types of incidents. So loss and theft still sometimes occur despite an organization's best effort. So suppose you have given training to the employee, never leave your laptop unattended, right? You have given the training and he's just going to home. What will happen if someone break the glass of his car and he stole his laptop? It is nothing to do with the training because he was trained to never leave unattended. He was in a car and he was just looking something or something, or maybe someone, or the worst case, the car collided with, or he met with an accident, and due to the accident, the car is window is broken, and someone came and instead of helping, he just took his laptop and his valuable items and he's just run away. It happened. It's a kind of frequent problems we have seen around the world. So there, in the case, the training will not work. So what will work here? If you have your device encrypted, properly secure, the superb authentication control were in place, even though if you'll get the laptop, the data is not valuable. Sorry, that will not be kind of, your data is secure. Maybe he will be able to sell the hardware, but he'll never be have the access of your encrypted data. So someone says data is the new oil, data is the money, data is everything. Yeah, of course. So in that case, your data will be secure, right? So full disk encryption is a good way to protect your data. Like in Windows, you can use the BitLocker. In Linux systems, you can encrypt the entire disk, and for Mac also you can do. Mobile devices also support the full disk encryptions where you can encrypt the data. And the high-tech in 2000 modified the HIPAA breach notification by stating that if a device is lost or stolen and it can be proven that data is unreadable by either secure destructions or encryption, the loss is not reportable as a breach. So, as per the High-Tech Act of 2009, modified the HIPAA breach notifications, if you are able to prove that is not the data which were there in the lost device is unreadable by any secure destructions and by encryptions, if anyone try, you're safe. Means that the loss is not reportable as the breach because there's no data breach. No one is able to view your data, what was there inside the laptop, even someone has stolen your laptop. So full disk encryption for laptop and desktop is fairly easy to implement and usually comes with no additional cost, as most current operating systems come with kind of capabilities. So as I mentioned, Windows has BitLocker, Mac has own systems which it supports. But I'm sure in Windows Home Edition, this facility is not available. Like BitLocker, you can't enable it with the Home Edition, but like in Professional or Enterprise Edition. So surely the organizations will surely having a license for Enterprise. So it will work for sure. So now come to the conclusion. So according to the HHS, a major goal of the security rule is to protect the privacy of individuals' electronic health information while allowing organizations to adopt new technology to improve the quality and efficiency of the patient care. Understanding how to identify, document, store, transmit, and protect PHI is imperative to HIPAA compliance and having a solid risk management plan. So what you can do, you can just go to the HIPAA website. You can get a free HIPAA guide there. They have the best practices, they have the plan and the risk management procedure in place for the HIPAA and the healthcare industry specifically. You can just review it, and that's all for this session. So Once again, this is the entry point for the data. This is the storage, and this is the transmission, and this is when you must consider when you're structuring your data. And the PHI encryptions, every data must be encrypted, and either is leaving organizations by business associate, email, or whatever the medium it is, and you must protect. And the summary of it: please do full disk encryption on your every kind of devices, either is mobile, laptops, Mac, Linux, servers, emails, whatever it is. So thanks.